Hey folks, today we have a case of Grinspan syndrome, which is characterized by a triad of lichen planus, hypertension, and diabetes mellitus. Now, Grinspan and his associate presented coincidence of erosive lichen planus, diabetes mellitus, and hypertension. However, various other authors suggest that the presence of lichen planus in this triad is majorly because of the drugs they are consuming for the diabetes and hypertension. So there are two schools of thoughts. And if you want to know whether the Greenspan syndrome is iatrogenic or syndromic, then this video is for you. Hi, I am Dr. Neha, your maxillofacial physician and radiologist, and I report some of my interesting cases in this series of video. And today we got a recalcitrant case of oral lichen planus in a patient which is on medication for diabetes mellitus and hypertension. In this video, you will learn how to diagnose Greenspan syndrome, what are the different treatment protocol for it, what precautions to be taken in patient with hypertension and diabetes mellitus, and what are the different theories associated with it. So, watch the video till the end. So this is my patient who is 67-year-old female. We have already treated her for lichen planus 2 years back. We had histologically diagnosed her with oral lichen planus, and this time she is complaining of burning sensation in oral cavity even after taking the topical corticosteroid treatment since 2 months. In this slide, you could clearly see white lacy patch on both the sides of buccal mucosa extending over the gingiva, showing a more generalized condition. Patient's medical history is suggestive of hypertension, so she is taking amlodipine 5 mg and atenolol 50 mg since 7 years. She's also diabetic since 7 years, so she is taking metformin 500 mg and teneligliptin 20 mg OD. So now, before going to the examination and investigation, we'll have a review of literature on Greenspan syndrome. Now, Greenspan syndrome is a triad of symptoms of lichen planus, diabetes mellitus, and hypertension. Now, oral lichen planus is a chronic inflammatory disease of autoimmune origin, and it is also a potentially malignant disorder. Now, as it is a mucocutaneous lesion, it affects oral mucosa, skin, scalp, nails, and genital mucosa. The preponderance is seen in 30 to 50 years of the age with a female predilection. The most common site is the buccal mucosa, and it usually occurs bilaterally. There are various types of lichen planus like reticular, plaque-like, papule, erosive, or bullous. In our case, the lichen planus was a reticular type where you could clearly appreciate white lines, white keratotic lines, which is commonly called as Wickham's striae, and it was bordered by an erythematous border. Now, there is this different entity called as oral lichenoid reaction, which is similar to the oral lichen planus both histologically and clinically. These lichenoid reactions are termed according to the substance causing them. For example, if it is caused due to the dental substance like fillings, crown, bridges, implants, then it is called as oral lichenoid contact lesions. If it is caused due to the graft transplantation, then it is termed as oral lichenoid lesions of graft versus host disease. And if it is caused due to the consumption of systemic drug, then it is called as oral lichenoid drug reaction. Now, oral lichen planus in Greenspan syndrome, whether it is drug induced or it is a part of the syndrome, remains controversial. Now, coming back to our case, we asked our patient to visit her general physician to correct her fluctuating diabetic and hypertensive parameters. We also gave her a stress management protocol as she was undergoing some domestic problems. And we gave her systemic prednisolone 20 mg morning dose for 7 days and a tolabulin syrup before consuming food. This is a recall visit after 7 days where there is a 50% reduction in burning sensation and erythema. So we decided to continue same medication for 7 days and then tapering the steroid dose for next 7 days. So after around 20 days, the patient seems to be happy because the lesion and the burning sensation was reduced to 80 to 90%. On this day, the blood glucose level was normal and the hypertensive state was under control. And the patient was advised to give a visit, recall visit every 6 months, as oral lichen planus is a potentially malignant disorder. So that's it, folks. That was all about my case, which was Greenspan syndrome, a triad of lichen planus, diabetes mellitus, and hypertension. If you want to see more such interesting cases, do visit my channel. I will meet you in my next video. Till then, you take care of yourself.